Hi, I'm Dr. Bill Gradishar, Professor of Medicine at Northwestern University, and I want to welcome you to this Yerbba YouTube video that's going to focus on the question of, are you really cured after breast cancer? And again, when patients undergo therapy, and we're really talking about patients in a setting to a large degree who have earlier stage breast cancer, yet they're at a risk of the disease coming back, they undergo their local therapies with surgery or radiation therapy, and then the appropriate systemic therapy, which may be chemo or anti-HER2 therapy or endocrine therapy. It all depends on the certain kind of breast cancer that a patient may have. Once they complete that, there's no evidence of disease. So that's a phrase you'll often see in reports or maybe even in a clinical note that says NED, no evidence of disease. And that is often equated with, in some people's minds, that now I'm cured. And again, oncologists are hesitant to use the word cure for breast cancer, even in the best of circumstances. Again, we know that in many patients with early stage disease, they are indeed cured, but we can't predict in an individual patient who that is. And obviously, in a situation where a patient has higher risk disease, lots of positive nodes or a bigger tumor, that patient has a much higher risk of the disease showing up in the future, even though she is NED or he is NED at the time that you're having this conversation. And if you contrast that with somebody who has a much smaller tumor that's node negative, the vast majority of them are cured, but we don't know with 100% certainty that that is true for the individual patient that's sitting in front of you. And in fact, even in patients with smaller tumors that are node negative, there can be recurrences at 10, 15, and 20 years out. If you'd like to get more information about personalized treatment paths, including the different therapies that are available that might be appropriate for your situation, tailored to your tumor biology and health profile, you can get a Yerbba report which breaks down chemotherapy regimens, endocrine treatments, and other combinations, and provides specific information that may be appropriate for your case. And you also have an opportunity to interact with Yerbba's medical experts directly for evidence-based answers about your options, recurrence risk, or side effects from the therapy you have by going to yerbba.com. So there are many phrases that oncologists or caregivers may use to describe your situation. And I think it's probably worth going through those different terms so you have a sense what they mean to us and how they might be interpreted by you as a patient or a family member, loved one. So one of the common ones is cancer-free. And again, clinically, we usually judge whether a patient is free of disease by examining them, listening to any complaints they have, and only in certain circumstances would we get scans. This is obviously most relevant to patients with early stage breast cancer. We're not doing scans in the absence of symptoms, so we're judging based on clinical assessment that the patient's free of disease. The other phrase that's often used is no evidence of disease, which in many ways is much the same as cancer-free because, again, no evidence of disease is either based on a clinical evaluation alone, or if it were appropriate, the patient may get scans and there's no evidence of disease. So again, that NED and cancer-free are often used somewhat interchangeably. The word cure is one that means that the disease will never come back. And that's sort of like a guarantee. Now, in patients that have invasive disease, there is a probability, depending on the patient's circumstances, for instance, an itty-bitty tiny invasive tumor with no lymph node involvement versus somebody that has a huge tumor and lots of positive nodes, that the variability in what we can say about what might happen in the future is stark. So somebody with a very small tumor with no nodes involved, they have a high probability of being cured. The patient who has a much higher risk based on the nodes or tumor size or other molecular features, they're free of disease at this moment, but they have an ongoing risk of disease recurrence that's higher than that other example. So we can say with probabilities that a patient who has similar features might be cured. We can't tell the patient sitting in front of us that they are cured because we just don't know. We don't have a magic way of doing that. Another phrase that's commonly used is complete remission. And, for most oncologists, that term is most relevant, obviously, in patients that have hematologic malignancies, and we're talking about breast cancer here. However, if you were a patient who was receiving preoperative therapy, so say the patient presents with a new diagnosis of breast cancer, and there's a decision, as an example, to give preoperative therapy before you go to surgery. When the patient receives that treatment and then ultimately goes to surgery, we look at the pathology report, and if there's no evidence of disease in the breast or the lymph nodes, we would say that's a PCR, a pathologic complete remission. So that is a pathology evaluation of a tumor specimen indicating that nothing is present. Now, in patients who have advanced disease, which hasn't been what we've been focused on to a great degree right now, but in a patient who has advanced disease, getting scans fairly frequently. And based on the appearance of the scans, if we had known disease that completely disappeared, we would say the patient has a complete remission. And that's different than a pathologic complete remission because we don't have the pathology specimen to evaluate. But that's usually a phrase, CR, or complete remission, that's used in the setting of patients with advanced disease. And of course, complete remission is good, but that also does not necessarily translate into cure of somebody that has metastatic disease. So the word cure has many, it's heavily weighted by many different thoughts in a patient's mind. And obviously they want to hear those words come out of their physician's mouth, that they are cured of the disease. And, again, that's challenging for an oncologist to say with any certainty to any patient. And it can be very frustrating to patients that they always have that nagging concern that despite their current circumstances where there's no evidence of disease, they can't necessarily equate that with 100% confidence that they are cured. And that's always sort of nagging them in their minds. So I think, it's challenging to reassure people with 100% certainty, but we always try to tell patients each year that goes by without any evidence of the disease returning improves your chances that the disease will never come back and that you are ultimately cured. So we have to go through this sort of mental process of reassuring patients and at the same time be vigilant for any concern that may represent activity of the disease. So in closing, we discussed the terminology that often is discussed with patients: NED, cancer-free, curative intent, CR. These are phrases we use to make judgments along the way about how you're doing. And again, having no evidence of disease and having a situation that we refer to as a complete response to some form of therapy, all good news. Sometimes your oncologist will obviously be reluctant to say, you are cured. I can 100% guarantee that. But again, the absence of being able to say that is not bad news. The fact that there is no evidence of disease is great news. And I think that the longer that you can continue to hear that phrase, the more likely you are downstream to actually be cured. So with that, I want to thank you for listening to this Yerbba video focusing on, am I really cured after breast cancer? If you'd like to learn more, subscribe to yerbba.com, and I hope to talk to you in the future on other topics related to breast cancer.